right. On to Melody Xu from UCSF, a pilot education program to train and empower radiation oncology medical assistants.
Thank you so much for the opportunity to present about our education program for rad-onc medical assistants at UCSF. We know that radiation oncology clinics are interprofessional, which means that patients may see medical assistants or MAs, radiation therapy techs, nurses, and physicians all on the same day. And the issue is that there are varying levels of formal oncologic training among these varying professions, and I'd say that medical assistants probably have the least. If you compare some of the education requirements among these different professions, we're very familiar with what it takes to become a radiation oncologist. For nursing staff, it's quite heterogeneous, but at least there's some kind of foundational knowledge of anatomy, physiology, cancer biology, and some kind of oncology care. For medical assistants, they're really coming to us with a diploma, maybe a certificate, maybe an associate's degree, and the idea is that they're going to receive some kind of continuing education on the job. But the problem is that even within tertiary academic medical centers, MAs may lack access to continuing medical education and especially training in oncologic subspecialties. And I think that part of this reason is because it's really challenging to target information. It's quite complex to their level of understanding. So our objective was to determine the need for and interest in an introductory oncology curriculum, and if there was an interest, to design a monthly resident-led curriculum. Our needs assessment suggests that there are no dedicated lecture hours or educational material for our medical assistants. Some of them have been working there for many years. 100% were very interested in monthly education sessions, and the topics of interest range from both within the scope of practice to outside their scope of practice. Things like radiation biology and physics and machines were of great interest to them. So after petitioning for first 30 minutes a month, and now we're at 1 hour a month with their managers, we designed a curriculum with the following priorities: applicability to their daily work, elevating their responsibilities within their scope of practice, expanding their clinical knowledge base, increasing intellectual curiosity, and then establishing a regular education time, which is more of a cultural shift simply because there wasn't any education time before. This is an example of our syllabus. It's really broad, but the amount of depth that we go into is not so deep. Right now we're on radiation machines, so on Monday they're going to go on a tour of the CT sim room and the machine rooms. Some of them, like I said, have been working for years, and they ask, what is a backlog bag? So I think that this will be a really helpful tour for them. For evaluations, we do pre- and post-session surveys. So on the right is an example of our medications session, where they're asked to rate their comfort level on the following topics from very uncomfortable to very comfortable. And then we had 3, 9, and 15-month feedback surveys to gauge how they feel the quality of the sessions are and also their overall, the impact on their work. These are some example slides. This was from the triage session, talking about when to inform us, when to call a code blue, don't be afraid, if they're really sick you need to just call. And then this is an example of the prostate cancer management by risk group at our institution. Our patients have a variety of options, and I thought that this would be really helpful for them to see why some patients are getting mixes of different types of treatment modalities. But as it turns out, they're not really interested in our questions like, what is Lupron? How does it work? What is a PSA? Why do prostate cancer patients get PSAs and no one else? So as it turns out, the highest yield topics are maybe not what you would imagine. These are risk factors for cancer symptoms at presentation. These are kind of the theme questions where the point increase from pre to post survey was at least 3. And imagine this being someone who's really curious at a cocktail party about your job and just kind of pepper you with a lot of questions about what is cancer. This is, for them, heightened because they're seeing cancer patients on a daily basis. They don't have the kind of background to understand what's actually going on. And then similarly for radiation side effects, I think mostly because they see a lot of radiation side effects but aren't really connecting the dots as to why this is happening to the patients. These are some of the box and whisker plots from our feedback surveys. On the x-axis are a list of questions about the quality of the education session, so clarity, relevancy, level of information. On the y-axis is a scale from strongly disagree to strongly agree. And then the gray, blue, and green are the 3, 9, and 15-month responses, respectively. You can see that initially the gray was kind of a little bit more variable. And as time has gone on, I think we've really tightened that so that they feel like the quality of the sessions are to the level that they're expecting. This is a similar box and whisker plot, but on the effect of these education sessions on their personal work. So on the x-axis, it's questions like, do you feel like you have improved in your clinical knowledge pertaining to your scope of practice, outside your scope of practice, your level of empathy and confidence at work, etc. So again, I think we're generally scoring very high, especially high in the first 4 categories, which is very gratifying to see. So what we've learned is that monthly didactics can be feasibly implemented to fill a needed gap in MA education. It improves staff empathy, confidence, and a sense of empowerment that's sustained over time. Facilitates the resident as teacher experience, especially during the off-season when we don't have as many medical students running through a department. And then with regard to future work, seeking sustainable leadership within our department, and also exploring opportunities to enhance interprofessional education within our cancer center. And here I'll just take the last 30 seconds to say that at first when we thought about this future work, we thought it would be very, very far away in the distant future, but as it turns out, in the last quarter, this wonderful thing has happened where we have this true north board in our department. It has like pillars pertaining to the, I guess, most important priorities of our institution. One of them is education. And this MA program has been highlighted on there, and when the Cancer Center leadership comes by and we see it, they got really enthusiastic and they're very supportive, and in turn our administration has also kind of, I guess, jumped on and decided that this is a great thing. So in our department there's been a lot more talk about interprofessional education and also how to expand this access to other medical assistants within our cancer center. So maybe it's a little closer.